Hi there. I'm Arjun Srinivasan. I am the Associate Director for Healthcare-Associated Infection Prevention Programs, the Division of Healthcare Quality Promotion at the Centers for Disease Control and Prevention. And it's a privilege to be able to join you via this recorded webinar meeting to talk a little bit about surge for the COVID-19 response for healthcare facilities here in the United States. I want to thank Leapfrog for pulling this together so quickly. And more than that, thank all of you for taking time to look at this and to think about this. The very fact that you are accessing this information indicates that you know what this situation is. We are worried that there is going to be a tremendous surge in the need for healthcare in the United States because of the COVID-19 outbreak. We have seen that happen in countries that are further along in this epidemic than we are. And we've also seen the need for surge capacity in the locations here in the United States that have had larger numbers of cases. And what I think we're learning from that early experience is that the COVID epidemic moves with astonishing speed. Very hard to emphasize just how fast this happens. There have been just some eye-opening discussions with some of the folks who are on the front lines in New York and in Washington who have really sent this message that you have got to be ready well in advance, because by the time it starts, it may move so fast that it's too late to be reactive. We've got to be proactive. So I really think this is the time for all healthcare facilities in the United States, not just to be thinking about surge planning or what they might do, but to really moving forward into a very active stage of planning, making plans, putting processes, putting even structures into place, thinking about all of the things that we do with surge planning, right? The S's, if you will, the staffing, the supplies, the space, the systems that need to be in place. How are we going to accommodate? And whether that means if you're a hospital with an intensive care capacity, how could you accommodate those increases in demand? How might you accommodate more hospitalized patients, triage in your emergency facilities, all of those types of things. We've seen calls nationally to begin scaling back elective procedures. And so thinking about how you might start scaling back elective procedures in the outpatient areas and where those resources might inform your surge planning. But I think more than anything, the message has to be, as a nation, as a healthcare system, we have to move from we're just going to think about it and see where we are in a couple of weeks stage to we have to start planning right now and putting those plans in place. You're going to hear from a number of experts on this webinar who have done this, who have a lot of experience with how you might do this. And so I hope that those presentations will help you inform your planning efforts. We recognize that this has to be tailored. Every place looks a little bit different. But what I really want to share from our perspective at CDC is that we so appreciate the fact that you are taking this seriously and you are making plans to help your healthcare system prepare to accommodate that surge, to be resilient so that we can continue to provide the very best care that we possibly can to patients who are going to not only be impacted by COVID, but for all of the other patients who depend on the healthcare system day in and day out to provide that care. So want to thank all of you, thank Leapfrog for putting this webinar together. I know you're going to learn a lot. We continue to stand ready at CDC to help you in any way that we can, and I do hope you will let us know what we can do to support your efforts to prepare for and to care for patients in this absolutely unprecedented time. So thank you very much, and thanks again to Leapfrog for pulling this together.